Alderneys Key FM.
I'd like to say good morning to the President, William Tate. Good morning, William.
Good morning, Dougal, and good morning to everybody listening.
Yeah, and how are you?
Well, I'm very well this morning, Dougal. I have to say, we got an hour yesterday to plant our beans.
Lovely.
So, the boss is happy. So, yeah, it's all good.
That's good then. Right, I'm going to hand over to you, William, for your interview today, okay?
Oh, I just ought to mention, Dougal.
Yes.
I think this is a little bit of an anniversary for us, because I think it's 4 weeks today.
Is it really?
Doesn't time fly?
That is a matter of opinion, I have to say, but yes, it is. It is 4 weeks today. Really, that's incredible, isn't it?
Yeah, it is, absolutely. So anyway, here we go.
Okay, then.
Okay, well, we'll start where we always start, with the latest figures from Guernsey. So there have now been 228 positive tests for COVID-19, all of them on the island of Guernsey. There have been, sadly, 8 deaths from COVID-19. Only one of those deaths has been in hospital, so that the figure which is comparable with the UK figures. Because as we know, in the UK, the only figures which are mentioned in the press briefings on a daily basis are those people who have sadly lost their life in hospital. So there have also been 3 deaths in Guernsey where COVID-19 was not the main cause of death, but was present in the person who died. So as Dr. Brink said yesterday, they might have had an underlying health condition, and unfortunately they died, but the suspicion is that COVID-19 was in fact responsible. So there are now 69 people who have recovered after having had COVID-19 in Guernsey. So that's a very encouraging figure. Now, I just thought that it's been a month now that I've been doing these radio broadcasts, so we should perhaps just sort of look back and see where we are, where we've come from, and where we might be going. So the lockdown restrictions came into force on the 24th of March, and it was decided by the Civil Contingencies Authority on the 7th of April that the restrictions should remain in place for a further 14 days. At that stage, non-essential retailers were allowed to operate on a home delivery basis, which I think has been a very welcome innovation and has allowed, I suspect, a lot of us amateur gardeners to be able to get the stuff we need delivered by Blanchard, which again has worked incredibly well, so that people like us can get on with growing some vegetables for later in the year. But other than that change, the restrictions remained in place. The aim of the restriction was to reduce the rate that new infections were taking place, and the emerging evidence is that it is working. At first, the positive cases were all related to people returning to the bailiwick from other countries. Then the virus appeared to spread into a GP surgery in Guernsey and into residential care homes, and a small number of cases appear to have been transmitted in the community. Tackling the cases in the care homes, both staff and residents, and the contacts of those people who have had positive diagnosis has been a huge task, but is paying off. The number of cases which are not traced back to either the care homes or people who travelled into the bailiwick remains a small proportion of the total cases. So the strategy of test, contact trace, and quarantine, together with the social distancing restrictions, is working. Cases are not increasing exponentially. So what we're not seeing is that steep curve which has been present in countries where the virus has taken hold and the attempts to contain it have not been able to keep pace with it. So what we're seeing is a steady line and not one which is going vertical. And that is a fantastic testament to the strategy that Dr. Brink and her team have put in place. And again, for as she said yesterday, a small community, we have really been able to be in front on this. So again, fantastic news. So what that is doing is helping to contain the risk that the health services might be overwhelmed. So as long as the health services have the capacity, then they can treat the virus as and when it occurs. So what everybody is looking to do is to slow down the virus and to, as we keep hearing that expression, flatten the curve so that our health professionals can keep on top of it. So that's all incredibly positive. Again, I keep saying it, but a massive thank you to Liz and all her staff at the Connaught. I received a phone call from somebody at the weekend who has a relative who is in the Connaught, and there was a problem, and I know that on Monday morning that problem was addressed by Liz and the team, and it was resolved. So it's just a really good example of teamwork, providing the care to those who need it and finding solutions to the problems that have resulted in the restriction in people's movements. So I think we can all, and I saw that at first hand, so I think we can all be incredibly proud of the way in which Liz is handling what I think at the moment is the most difficult human challenge. So there are lots of people starting to ask the question, rightly so, how do we get ourselves out of this situation? And I understand that it's a particular worry for people who are concerned about their job, their businesses, and how they are going to pay the bills. I have to be honest and say that I think there is some way to go yet before we can begin to start any significant release of any of the restrictions. And I think the Health Secretary, Matt Hancock, was on the radio this morning saying exactly the same thing for the UK. So unhappily, much as we would like to be able to say to people that they could go back to work and we could get back to some sort of normality, the risk is too great until such time as the science and the medical opinion is able to say that the risk is manageable. So it's a very difficult thing for me to say because I know how difficult it is for people and I know how frustrating it is and I know how not having enough money sometimes can become almost overwhelming. But we've stood together this far and we will continue to stand together going forward because, as Dominic Raab said last week, we cannot allow the sacrifices that have been made. We cannot allow all the efforts that we have all made as communities to be wasted if those restrictions are released too quickly, the virus takes hold again, and we find ourselves potentially in a worse situation than when we started. So these are incredibly difficult decisions for the experts to make and for the politicians, but the politicians will be guided by the science and they will be guided by their fundamental responsibility to protect those people in their community and to support them in whatever way they can, financially, emotionally, or just giving people confidence to know that what is being done is the right thing. And it's been pointed out many times, in an emergency situation like this, you don't get everything right. And it is very heartwarming to see that there is that recognition. So there will be occasions when people feel that the wrong decisions have been made, but please rest assured these are decisions are made with a pure heart and they are made in a real consistent way to try and protect us all. Now, people talk about the vaccine, and I think we need to be realistic about that. There are all sorts of times and dates which are put out there, but the best estimates are that it may well take a year. Now, there are, I think, in excess of 70 trials and research projects going on at the moment, and I did hear a scientist say at the weekend that he was reasonably confident that they would find a vaccine, but of course, having found it biologically, it then has to be tested, it then has to be approved, it then has to be produced, and it then has to be made available. So, I hate to have to say this, but there's no quick fix to this. So we all just have to, again, trust all these scientists who are working tirelessly to find the answer to the problem, and then as and when that is available, there will no doubt be massive vaccinations, and we can then safely say that we have beat the problem and we can go back to what will be the new normal. So it's likely that we will have to continue the current approach for some time to come. That will mean testing as widely as we can to detect the virus, tracing and quarantining contacts of anyone who tests positive, being very aware of the symptoms of COVID-19. And we will need to maintain many of our rules about social distancing for the foreseeable future. That will mean that we won't be able to have gatherings of more than 2 in public. It will mean that we stay at home other than for essential shopping, essential work, medical appointments and daily exercise. It will mean that pubs and restaurants stay closed for the time being. It will mean that there won't be any non-essential travel for some time. Now, people have speculated, and this process has started in Italy, and I think it's also being put in place in Germany, that when restrictions are lifted, it will be a very gradual process with a careful and staged removal of one restriction at a time. And that those restrictions might be quickly reimposed if the virus emerges again. I think the cautious approach is very likely to the way that we go, but as and when restrictions are lifted, I think we are likely to need those who are most vulnerable to the virus, the over 65s and those with underlying health conditions, to continue shielding themselves, staying at home and avoiding contact until such time as the risk to their health is eliminated. Now, I know that there's a lot of work still to do on the question of how and when restrictions might be lifted. It's a complex and risky area. And I'm also acutely aware that there are some businesses that would like to go back to work sooner rather than later, and we are, of course, trying to represent those interests and make those arguments as well. These are very difficult, finely balanced arguments, but the important thing to remember is the risk is to human life. And as I said before, if we let the genie out of the bottle, we probably won't get it back in again. So anyone who saw the live streaming yesterday of the media conference in Guernsey will have heard Dr. Brink say that they are now starting to look carefully at how lifting these restrictions might work. So that work is ongoing, and as and when it is felt that there is a way in which it can be introduced without increasing the risk of exposure and the virus, then on a step-by-step basis, that is the way that they will deal with this. And yes, it is incredibly frustrating, but let us not forget, we are extremely fortunate on our island because we have yet to have a confirmed case of the virus. So what we don't want to do is simply say, okay, everybody back to normal, because that really would waste all the time and the effort that we've all put into this. So please, I can only ask that we are patient, that we trust the science, that we trust the politicians, and when the time is right, we will all start to be able to get back to a little bit more of our old life. So the message really is the imperative to get this right. And the health experts and politicians in Guernsey are carrying an awful lot on their shoulders right now. But we'll make sure they understand when these conversations take place that we have our own needs here, but we have to trust their judgment because they are making policy for the whole of the bailiwick. And it might not always fit and sit comfortably in certain areas, but their overall responsibility is to keep every one of us safe in the bailiwick. But that is not to say that we will not keep making the case. So we'll keep talking, we'll keep thinking this through and making adjustments where we can. It will inevitably be slower and not as easy as we think or we would like. But I think we've said right from the very start, this is a marathon, not a sprint. Now, one final thing that seems to have caused some confusion overnight is the coverage yesterday about an exemption to allow some restaurant takeaway meals which can help bring resilience to our Meals on Wheels service. People have asked for clarification of what this means. Now, there was a media release yesterday afternoon, and the State of Alderney have asked for some clarification of what that in fact looks like. And I think the confusion has arisen because an application was made for exemption orders in respect of 4 of our restaurants in order that they could deliver restaurant food to people's homes to lessen the burden on the Meals on Wheels service and to give us greater resilience if there was an increased need for Meals on Wheels in the community. Now, for those who might think we didn't put forward a strong enough case, you are wrong. We put forward a well-argued, coherent, logical case, but we're somewhat puzzled because the question we asked did not receive an answer. The answer we got related to a question that we hadn't asked. So what in fact seems to be the position is that one or all of these restaurants could partnership with Meals on Wheels in the future if required to deliver Meals on Wheels food to the community. Now, I've been in touch with Liz Bowskill, and she has assessed where we actually are with the Meals on Wheels service. And what she says is we still have some resilience in our Meals on Wheels provision and support from the hospital should we reach capacity. Meals on Wheels is aimed at individuals who have been assessed to not be in a position to shop or cook a balanced, nutritious meal for themselves. So it's not simply a question of asking for Meals on Wheels. There are certain criteria which have to be satisfied, and Liz makes an assessment of that need based on the person's individual circumstances. So I think there was some confusion in that some people seem to think that this was Meals on Wheels acting as Deliveroo, so that people could order a restaurant meal and Meals on Wheels would take it to their homes. Well, that makes no sense at all, and it certainly isn't what we understand the decision to have been made. So the decision has been made. If we were in a position where we needed more resilience for the Meals on Wheels service, it could be available through one of the restaurants. But they would have to provide the same food that was cooked at the Connaught for the same price that is charged to the person who gets the food. So that's there, but we're still waiting for clarification as to how that decision was arrived at, rather than giving us a decision on what we actually asked. But I would point out, and this I think is incredibly important, that we do not want any of our residents who currently have Meals on Wheels to think that maybe they won't have them because there might be somebody more deserving than they are. Now, that's entirely understandable, and it's a very human and a very compassionate response. But that isn't how things are. The people who are getting their Meals on Wheels now will continue to do so and should continue to do so. We have some resilience in the event that we need to increase the supply, and we've got further resilience if we need in the future to bring the restaurants into play. So please, everybody who has Meals on Wheels, continue if you need them to order them, and the Connaught staff, supplemented by our volunteers, will continue to deliver you a hot, nutritious, well-balanced meal for lunch every day. So please do not be concerned about that. So as and when we get further information from Guernsey, we asked for it last night, but we haven't had it, we will share that. But it's certainly a confusing situation, and we hope to be able to give some better explanation either today or on Monday. Okay, so the next thing on my list is a massive thank you to all the businesses that have completed the questionnaire that I spoke about the other day. I've had contact with the Chamber of Commerce. They have already had 72 responses in 2 days, and I suspect that it will by now be more. Now, that, you recall, I mentioned, is part of work which is being carried out within the civil service on looking at what the economic impact of this crisis will have upon our island. And as I said the other day, we need that hard information so that we know where we will be, and then when we know where we will be, we can look at what resources we have available and what the future might look like and what areas we might need to concentrate on. So it's going to give us a blueprint for the future. But the work that's being done now is carried out by the civil service, and when that work is complete, that will then be delivered to our politicians, and they will then discuss that work, and they will form the policy around it. So we are looking at how the future might unfold. We're looking at how to make sure that we are as secure as possible. We identify the options for the future, and we move forward as a community. So again, thank you for everybody that's completed that, because it really makes all the work that's being done far easier and gives them a much better impression of where we are at. Okay, so next thing, I know you've mentioned it on the radio already this morning, but Barbara Benfield's appeal to the children of the island to write to our most senior and respected members of the community. I spoke to Barbara a couple of days ago. She was staggered at the response, and I think she's probably, well, I spoke to her about this a couple of days ago. She'd already received almost 50 letters from the children and drawings. She had already delivered those to some of our elderly residents, and it was a very uplifting experience. So again, this is the community acting together and supporting those who need it most at this difficult time. So again, let me just read it out, for the people who didn't hear it earlier on the radio, the email address, if you want to scan the letter to Barb, is barb, B-A-R-B-B, at cwgsy.net, B-A-R-B-B at quigsy.net, or you can push them under the door of the charity shop, or you can send them to her home address at 1 Butte Flats, Butte Road, Alderney. So she suspects she's going to need an awful lot more. So children, it's a really important thing to do. You will make a new friend. You will learn a huge amount from those in our community who have wisdom and will see this challenge perhaps in a very different way to others. So again, fantastic initiative. Thanks to Barbara. Next one, interestingly, a couple of nights ago on Channel Reports, I saw Senator Christina Moore being interviewed, and she said she'd received a request from a senior member of the community, an elderly member, saying that what she really wanted was one source of reliable information which she could then trust, and she would like that by way of a radio broadcast done at the same time every day, and she felt that that would give her a focus and it would give her an opportunity to have all the up-to-date information as and when it happened. Now that, to all of us, I think, might just sound a bit familiar, because once again, I think we have led the Channel Islands in our response, and having done this now for a month, I still get emails, I still get letters from people saying how valuable they think this has been. So I think that, again, we've been punching beyond our weight, and I think as in so many areas, we've actually led the way. So I think that, again, thanks to Dougal, thanks to everybody, and it's certainly given everybody here the opportunity of sharing the information, and I hope feeling part and parcel of the struggle that we're going through at the moment. Finally, I think we're getting to the end now. It's Thursday, and we know that in the UK on Thursday, people stand outside their homes and clap as a way of saying thank you. And it's developed here. So what we're asking this morning is that people actually use their phones to record themselves clapping and showing their support, and then uploading that onto Facebook with the hashtag Alderney Spirit. So that's our way of saying thank you to those people who are going the extra mile to keep us all safe. And I know that tonight that the emergency services will also be giving their thanks to us. So, I think, Dougal, that's me done.
Thank you very much, William, and thank you for clarifying the thing about delivers food as well. As you say, there was quite a lot of questions about that, and I'm sure you've clarified that very well. So thank you once again. I'm not sure when we're going to be speaking again, but I will discuss it with you, no doubt. And
unless, we'll talk over the weekend.
Yes, we will.
Okay.
Okay.
And I think, unless you've got any questions, Dougal, I think that's me.
I think you've answered all of my questions, William. So thank you very much indeed.
Thanks to everybody that listens, and stay safe.
Yes, and you stay safe as well. So, President William Tate, thank you very much indeed for the time being.
Alderney's Key FM.